So hello and welcome to the first of hopefully four webinars this year that we have pulled together based on the data that we got back from the INCA advocacy survey. So thanks for everybody who completed that. We're hoping that these webinars are a chance to gain education, share best practices, certainly from our membership, but also more importantly, discussion time. We also hope to translate slides where we can into various different languages. So I'm really hoping that that will encourage viewing outside of this webinar time. Obviously, these will all be available on our members area. But today we're going to start with all things media, and we're really delighted to be joined by Meredith and Adi from NeuroEndocrine Cancer Australia, who are going to share their insights and experience around media outreach. And we reached out to them because they have had many successful media campaigns to date, and I think it's going to be really interesting to understand how they've reached the level of success that they have, and maybe give us all some hints and tips on how we can do better with engaging with all forms of media, which of course is a really important tool for us as advocates. So I will hand over to Meredith now, who I believe is just going to start with a presentation, and I think you're going to be sharing that with Adi. Is that right?
That's right. So we're going to do a bit of a tag team. So we're going to, cover different areas. So I'm Meredith Cummins. I'm CEO for NeuroEndocrine Cancer Australia, and my co-facilitator is Adi Williams, who is our Marketing and Partnerships Manager. So what we're going to look at is targeting the Australian public and healthcare professionals with symptom awareness messages from neuroendocrine cancer. And a year ago, we got funding from the federal government in Australia to run an awareness campaign and also to increase some resources and promote the optimal care pathway. So we're going to go through what happened in that year and also just add in a few other activities that we're doing, that is us doing our own advocacy and public relations. So next slide.
Thanks, Em. My name's Adi. So the first area of the campaign was doing the creative. And as we know, it's quite a complex message to try and get across. So we wanted to make sure that we included everyone. So we had 6 personas that represented a cross-section of the Australian public. And this camouflage campaign was thought about because obviously neuroendocrine cancer frequently camouflages itself. And we wanted to capture something that was understood really in under 3 seconds when people were scrolling through their phones. We wanted to get their attention really quickly, something that's really quick to understand. So looking at this image, if a patient may have had all these symptoms, or if you're a healthcare professional and someone's reported these symptoms, it was really clear that possibly you should consider neuroendocrine cancer. And consistency across the campaign was key. So what we really wanted to do was emphasise the grey area. It's not just black and white. So when consumers and HCPs are faced with these consistent symptoms, consider the grey area and think neuroendocrine cancer. And we used this creative right across all campaigns. So whether it be Facebook, Instagram, Twitter, LinkedIn, Google Ads, YouTube, this creative was used the entire way through in conjunction with some fantastic patient stories. And Meredith, this is your slide for advocacy.
Yep. Yeah, and just with those faces, we went for a whole lot of different faces and different ages and everything so that we could cover all races and sexes and age across the board. So this is just a quick update on some advocacy that we did, some of it with the awareness campaign, and we've done patient forums. We did one in Brisbane, and with the awareness campaign, we did get some funding that we recorded these forums, which before the forums, also we did some Vox Pop. So we had some of the patients just doing some key messages and just doing short videos on that, but we'll talk a bit more about that further into the presentation. We also put together some explainer videos, which we've got on our website. We did one for peptide receptor radionuclide therapy, or ligand therapy, radioligand, as you call it. And also we've just recently done neuroendocrine cancer and genetics, which is another explainer. So we attended a lot of conferences. We've put a lot of posters in for our awareness campaign, our education, and luckily we've been able to present those in podiums as well. And we did some other forums, one in Perth in Western Australia and one in Adelaide as well. And again, we did recordings, and we had healthcare professionals doing recordings as well. With the advocacy, we were very busy last year with the Senate inquiry, which was called by, that's all right, the Senator Askew, who is a fabulous champion for us. But it was looking at equitable access for diagnostics and treatments for rare and less common cancers, including neuroendocrine cancer. So we put in a submission for that, and then they actually had public hearings in 5 locations around Australia where we actually gave evidence. And from that, they've taken a whole lot of recommendations which have come out recently for improving the care and the management for neuroendocrine cancers and rare and less common cancers. And there were 41 recommendations, which we're now working very closely to advocate with the government to have them implemented. And also this year, I think with the fact that we've been advocating so much and definitely being heard, the Australian Cancer Nursing and Navigation Program, the government has provided funding for that, and we put in, we were actually nominated with a closed non-competitive grant to have specialist support services funded for 4 years. So that means our telehealth nurses, and we're also looking at increasing and having a dietitian and counsellors available for patients around Australia free of charge. So we're just definitely working really hard to get heard, and so far it's been good. Next slide.
The most important part of the campaign before we got started was to develop a strategy. So definitely aligning yourself with an agency who understands your goals is recommended. Not all agencies are the same. And we did start off by speaking to a couple of the bigger agencies, and soon found out the bigger agencies charge bigger commissions, and we would end up with less bang for our buck. So we're really careful about the partners we selected. So for the partners, we needed a public relations partner, what we call earned media. So we weren't guaranteed anything from the public relations. Our agreement was to have 20 stories over the 12 months, but it's never obviously guaranteed when it's public relations. We had a video content creation partner that developed some amazing patient stories. So we got a patient story from nearly every market in Australia. And to partner with those, we had a healthcare professional interviewed in the same states around Australia. We had a campaign creative and digital marketing partner for our paid media, for all our paid ads on Google and right across the social media and YouTube. And we had a search engine optimization partner, SEO partner for paid media as well. So for the 12-month campaign, we met with all our partners each week, apart from the videography that was sort of done in the first 4 months, and then we didn't have to sort of continue meeting with them. But it was a weekly meeting just to see where we're at, see how we're going with the digital, see how we're going with the public relations campaign. So we kept in really tight with them. And the weekly meetings with the public relations campaign company, they were new partners for NECA. So more often than not, it was them learning a little bit more about NETs or about patients, or about the way things work. So it was an education process, particularly for the first 6 months of the campaign. From the outset, we agreed to be nimble and fluid. So if things weren't working, we would change it, or if things needed to be optimized, we would optimize it. And we definitely had to lean on that along the way. We didn't want to miss an opportunity with media, so it didn't matter how small the news piece was. We worked really hard to make sure that Nets had a say in that area. Having said that, the double-edged sword there was we realised don't try and put a square peg into a round hole. So a couple of times We did try to get on conversations. If something was, one particular conversation was the cost of scans, I think it was, and we were trying to peg neuroendocrine cancer into that story, but we spent a lot of time getting the right patient, getting Meredith interviewed, getting healthcare professionals interviewed, and at the end of the day, it was a huge article on scanning with maybe neuroendocrine cancer mentioned twice, so that probably wasn't worth our while. So early on, we were just saying yes to everything, and then we learned to just to pick and choose a little bit to make sure it was about neuroendocrine cancer, not sort of trying to get on someone else's conversation. And also being clear with your message. Obviously, that's important in a digital campaign, but really important in a public relations campaign. So there are a couple of areas there where we thought, in hindsight, we could have probably cut back on the message or maybe stuck to our guns a little bit, because you don't know what's going to end up on the editing room floor and what's going to end up going live, you know, going to TV, radio, press, or any of those things. So we learned probably less is more and keep the conversation short so that we can get our important messages across. The other thing was to not miss any opportunity where it was a small campaign. So we had generally, and we'll go into how we did the patient stories, it wouldn't matter if it was a regional outlet with, you know, maybe only have a population of 70 or 80,000 people. If we could get the story out there, because everything now is syndicated, what we found was we had one in Queensland where a gentleman did one small story and then it got syndicated all the way around Australia and had a huge reach in the end. But that was going to be for a small local TV story, and then it went to local TV outlets in every area. So we think because, you know, originally we tried to have big stories for nets, but as we know, there's not new developments every single year or every quarter. So we're relying on those patient stories to really drive the majority of our campaign. And even though we did obviously organic posts the whole way through, 99% of our coverage was paid and earned media through the public relations company. And what we learned was any journalist that did a story, just to keep in contact with them and just gently, we want to keep these long-term relationships. We don't want to do a story about one patient and then exhaust them, keep going back to the same people over and over again, but it was a good opportunity to educate people. We had a lovely radio station from Tamworth, which is in regional Australia, and that man really took a shine to the patient that he was interviewing, and he ended up doing 5 or 6 different radio reports and has offered just for us to keep him in the loop. So it's a really good opportunity to get those journalists on side and continue to share our story with them. And oopsie, just skip forward a little bit. For the whole campaign, we'll come back to this, Australia's got a population of about 25 million. So the entire campaign for public relations potentially reached 105 million, and the paid digital campaign reached 15 million. So we had a huge bang for our buck. It wasn't a large investment that we did. And a lot of that came from being really smart with our SEO. So search engine optimization, or SEO, refers to methods used to make your website rank higher on Google. The higher your website ranks for relevant keywords, the easier it is for people to find you. And early on, we said, wouldn't it be great if someone got diagnosed with neuroendocrine cancer and then came out of the doctor's surgery, Googled it, and then found us straight away? That would be a dream. And we're pleased to say that happened quite a few times across the campaign, and we're reaching people earlier in their diagnostic cycle. And really, there are no tricks or clever things to doing this other than we're not experts in this area. So we partnered with someone who was an expert in this area. So our daily organic impressions on SEO went from 2,839 to just under 10,000. So we certainly went right up the page. In some areas, we went from page 6 to page 1. We did things like used relevant keywords for our content. We started by creating articles on search terms that we knew our community would search. So one thing we knew our community, would search is what is a neuroendocrine cancer, which sounds basic, but then we did an article on there. So we had lots of things PDF'd on our website, but that doesn't help your SEO. It needs to be words written on the website. So Meredith was busy the whole way through. I think we ended up doing 42 different articles. A lot of them were quite basic, but just putting those words back into our website with backlinks. We need to make sure the website is mobile friendly, so it looks just as good from a mobile or a tablet or an iPad than it does from your PC. and get backlinks from reputable websites, so online PR articles. And that really helped push us up. We did have a challenge just before the campaign started. In Australia, we had the Optimal Care Pathway launch the year prior. And before that launched, NECA would always be sort of top 3 to 5 people. So if you looked up neuroendocrine cancer, we'd come up number 3 or 5. And then because the Optimal Care Pathway launched, all the government agencies and the big cancer organisations had neuroendocrine cancer through their website. So we slipped back to page 6, and it was an issue because people just stopped finding us. So we had to work really, really hard on our SEO throughout the campaign, and to get onto page 1 after 12 months, we're absolutely thrilled with that response. So that's SEO. Any questions about that at the end, please yell out. Now, we discussed the patients on a page for the public relations campaign. These were really, really important. As you know, everyone, you can have a different kind of net. You can be anywhere in Australia. For us, we could be anywhere in Australia, regional or metro. So what we wanted to do was make sure that we had each patient's detail on one page. And that's really important when we're going to speak to journalists. They want a really short story. So we made sure they all had a very strong headline. So Ryan's in particular he wanted access to belzutifan. So his would start off with why that would be life-changing to him. One of the headlines that really took off was a 40-year-old male has been diagnosed with menopause. So we relied on the public relations people to let us know what would be a catchy title, and the patients had buy-in all the way along. So the public relations company interviewed 20 patients, and that's really how they learned about NETS and NeuroEndocrine Cancer Australia and what we do. There was lots of tears throughout these interviews. Often we would speak to the team afterwards and they were quite moved by what they'd discussed. And the other benefit of that is they've just interviewed these patients. They didn't want those interviews to go to waste. They would work really, really hard to make sure that they had a story that got off the ground and that got some media coverage. And now for us ongoing, we have these patients on a page, so we can still continue to take these stories out to media and see if we can get some traction in that area. Now the patients on a page, these are great for any media. It doesn't matter whether it's TV, print or radio, because the first step is always trying to get the journalist interested. And as well as the patient on the page, we gave the media outlet a little 2-page document on neuroendocrine cancer and NECA that was basically, we'll call it a tell me, sell me. So all the questions that they might have in their head about what is neuroendocrine cancer, who do I contact, how many Australians have neuroendocrine cancer, do we have a special day? That was all on that 1-pager for them. And the variety of patients that we chose was literally all around Australia. So the campaign had 2 distinct target markets. One was for general public and one was for healthcare professionals, equally as important as each other. For the general public, as well as these camouflage campaigns, we showed videos, and the patient videos are a great way to get engagement. This one patient here, Jamie from Adelaide, her video had over 500,000 views. And together, this campaign had 7 million impressions across Facebook, Instagram, Google Ads, and YouTube. And we'll show you some ads shortly. We also did these in different languages as well, just to make sure we were connecting with everyone. And 20% of the campaign spend went specifically to targeting people in region Australia, and those people really need it most because they have less access to centres of excellence out in those areas. So in Australia, the most common languages outside English at home are Arabic and Mandarin. So this is what the Arabic and Mandarin campaigns look like. So exactly the same as the English-speaking campaigns, just in a different language. And we talked before about being nimble with the campaign. The first campaign we ran videos that were translated for what is neuroendocrine cancer and what are the symptoms. Those videos didn't really land that well. I think it was probably too much information too soon, perhaps. We don't know. But what we realised is when we changed that campaign over to a static image only, which were these images, that it worked really, really well. So we had great traction with this campaign. So again, just noticing things along the way, meeting with the digital agency and working out what does and doesn't work. Then the really important part of the campaign is when we had an ad, rather than take people straight back to the NECA homepage, our website is really busy. There's literally thousands and thousands of pages on there, and sometimes it can be overwhelming and you can't find what you like. So we created a landing page. So we had a landing page for consumers and a landing page for healthcare professionals. So every single ad pointed back to one of these pages. So the landing pages provide easy to understand information for neuroendocrine cancer, and the healthcare professional ones were slightly different in that they also led people back through to the optimal care pathway, the HCP learning modules, and healthcare professional interviews. So the healthcare professional ones were without a doubt more in depth, whereas the patient ones were more learning about the symptoms and what they can do if they felt like they had these symptoms. And we did guide them to what we call the quick reference guide, which is a condensed version of the optimal care pathway. So for the awareness campaign, we reached potentially 105 million people through the public relations campaign, which is a huge reach. 15 million impressions through the paid advertising, so that we could tweak along the way. And the reach also included healthcare professionals who were targeted through medical journals and websites. So just under 250,000 GPs were reached through the medical journals. And that was for our ads. And there was also a couple of stories that we had along the way, some editorial, which was very warmly welcomed. Finding the right, whoopsie daisy, Em.
That's right. So it was so important to find the right champions. So we targeted some of our healthcare professionals that we work very closely with, and they are so passionate about helping get the information out there. So we linked into our network and we got net champions, and we also got net champions that were patients as well. But we did find sort of with some of the recordings that we wanted to do, especially some of our champions that are so effective, when they work in the public hospital, it's not as easy for them to get to be able to do media. So there's a lot of restrictions as far as what they're allowed to do. So we were a little bit sneaky with some of them because some of them actually work in private facilities. So we would do the recordings in conjunction with their private practices, not the public ones, so that we could get that information out there. But it was aimed at developing an emotive element to the campaign. And so we created the patient stories and, as I said, Vox Pops and the healthcare professional videos, which covered net symptoms, and asking everybody basically to consider the grey area. And the short videos, sort of 30 seconds and 60 seconds, were very well received, and we had over 2 million views for those stories. Next one. So when we looked at the healthcare professional audience, we wanted to target healthcare professionals in Australia so that we could promote the interviews and the optimal care pathway. And the lady that you can see in the greeny coloured top is Professor Dorothy Keefe, who is actually a medical oncologist, but she is the head of Cancer Australia. And so they have all the control with the Australian Cancer Plan and the optimal care pathways and everything. So we approached her to do a video on the optimal care pathway for neuroendocrine tumour, and she was really happy to do that. And as you can see, she had 443,000 views just in that short period of time. And we also did a static campaign with materials, which you can see on X were 580,000 and LinkedIn 72,000. So 4.1 million in total for all the media impressions were obtained. Next, please. So then we look at the healthcare professionals with the print and digital ads, and we were targeting as many people as possible, and we ran the ads in Medicine Australia and RACGP, which is the Royal Australian College of GPs, Australian Journal for GPs, and combined print distribution was 223,000 and the digital reach was 115,346. And interestingly enough, as far as for GPs, in Australia there's 31,000 GPs. So it was a good reach for all of those. And also just as a a fact. There's 7,200 cancer nurses in Australia. We've managed to, when we have our registration done, have whether they're a cancer nurse or not sort of put onto their review of their registration. So we did have some feedback from one of our patients, and just saying, with all the information that we've provided so far, that they only wish that GPs and healthcare professionals I saw before my diagnosis, when I was looking for answers for 3 years, would have read similar material like this in this campaign. So it made it so much clearer. And I know there's some patients that we've had contact our nurses on the telephone, and just saying they've had the symptoms because they've become aware of them. And so the nurses have been able to say, you need to go and see your GP, but take the optimal care pathway quick reference guide for GPs with you, so that they then know what to look for and what tests to advise them to have. So that worked really well. So with the case studies, with the patient on a page, this is a bit of a selection of the people that we had, but we wanted to make sure that we had a great diversity of stories. And we've got patients in there who have got MEN, we've got patients who have got SDHB, or von Hippel-Lindau, and then all the other types of neuroendocrine tumours. So we just wanted to make sure that we had a really good cross-section of people so that we could get the story out, because as we all know, patient stories are so powerful, and I think the more diversity that you have, the better. And this is just a coverage of the media that we got. So we had, the project is quite a big television current affairs sort of program, and we managed to get, I think it was a nearly 6-minute slot on there, which did 3 stories of von Hippel-Lindau patients. So that was a real coup. But we went for the big newspapers, we went for television. Luckily, television, we were able to get some of the national channels, and also radio, and then Mamma Mia sort of is a magazine that is predominantly about female sort of health. So we tried to diversify as much as possible and just get as many stories out as we possibly could, and we had great success. Yes. I can't see the number. What's the number on that one?
I can't see the number.
It's you, I think.
So these stories here, so the potential reach from Amelia and the patients sharing their story was 10 million people. So when we originally started, this was pitched to us from the public relations company, like, what are these online outlets? We hadn't heard of some of them. I hadn't heard of some of them. I've been in media for a very long time, but they all add up. So once a story has started being published and starts getting developed into other outlets, that's when the reach really picks up. March for Nets we ran this year, so it was our first national fundraiser. That story made it into the Herald Sun, which had a potential reach of over 4 million people. And then one of Jamie's stories, which was one of the gorgeous videos we did, she was in Mamma Mia online with a huge reach of over 3 million people. So some of these stories that started off really, really small ended up having huge coverage. And this was probably an example, this Herald Sun story here, even though we reached 4 million people, that was a learning for the day. So we had, I think there were about 8 of us there on the day with our March for Nets t-shirts on. We had patients, we were jumping, we were marching, we were doing everything. And then the photographer sort of randomly took this photo at the end, and that's what ran. So next year when we do this, our learning is, if you're not in a March for Nets t-shirt, you don't get your photo done. we were learning along the way as well, but it was the story to it was actually okay, because it had the sort of coverage about Net Cancer Day. And the funding.
So thought I'd touch on here, because funding can always be a huge challenge, and where to get it. So in Australia, we have a website that you can go to, and there's the federal government as well that has any grants that are around. So we apply for any grants that we can possibly see and just go through all the websites. Some of the MPs that we are in touch with, they actually send through, it's called Grant Guru, and it has a whole lot of different grants that you can look to see what you can potentially go for. Also, we've been so fortunate with philanthropic patients, so we keep a very close eye on donations as they come through so that we can acknowledge and let them know what their funding could go towards, or if they have any recommendations of what they would like to have the funding to go towards. And we also ask the MPs how to access further funding, quite frequently without success, but we like to push the boundaries and see if we can get some more funding or not. And also, as far as the other not-for-profits around, we do talk and see what other people have got and whether there's any opportunity that we might be able to find out where their funding came from and apply for it as well. But I think with it, we really are very closely sort of lobbying with the MPs where possible. And just also finding out sort of any MPs that have special interests. And that actually happens with the journalists as well, where there might be a family member that has breast cancer or ovarian cancer. So I know a lot of the journalists will run those stories on their television programs and focus on those. And I know with neuroendocrine tumours, we don't really have many ambassadors or patients that we can utilise that to be able to sort of promote that. But a lot of the MPs, yeah, they do have what is happening with their family members or in their friends, and they will support those cancers. We've been very fortunate with our ambassador, Michael Usher, who is one of the senior journalists in Australia, and he said that he's pushed back on being an ambassador previously, but he really feels that sort of, in a way, we're the underdog, and he really wants to help us. So that's been super successful so far. And how do we get it? Being persistent and having persistent messaging, and that's with the patients and ourselves. So we do have a template letter that we use for various things. So we get the patients to tell their story and then to try and organise a meeting with the MP so that we can then meet together and talk through how the MP can actually help to champion for us. And having the right approach, sort of, that we approach, doesn't matter which political party it is, we go in and approach the same way, and being positive with the way that we go into the meetings and making sure that when we go in there that we have solutions that can be easily sort of either actioned or they can be presented by the MP in Parliament. So it's so important to have a champion that can then speak for you in Parliament. Next, please.
And for the patients speaking to MPs, we also have success when patients go directly to the media. It's just trying to give them all the information to do that. So whether it's just 3 short things to remember or the fact sheet on Nets for Australia, so they've got a little bit of information there and they feel comfortable, that they would have more success through the media. And the project story that ran was a great example of that, of patients going directly to the media. And then us being there as a support to help them with any medical questions or anything they get along the way.
And just that photo down the bottom left-hand side, the gentleman at the side there is Jamie, who is our Federal Health Minister's senior advisor. So he actually came to a Von Hippel-Lindau event we did recently. The next lady in the purpley jacket is Wendy Askew, who's the senator that called the Senate inquiry. And then the person next to me is one of the patients with Von Hippel-Lindau. And then the next person is Zali Stegel, who is a federal MP. She hosted the event for us. And then the next person, Liz de Summer, is actually the CEO for Medicines Australia. So it was a wonderful collection of very powerful people who were extremely touched by the whole event. Next, please.
And going back to the digital campaign snapshot, and we'll look at this in context with the INCA statistics. So for the digital campaign, so that was just across social media and Google Ads, so all the digital platforms with a paid campaign, we reached 13.4 million impressions. over 1.85 million impressions in organic search results, SEO, 31 links moved to a page 1 position, which is just unbelievable for patients and helping them find us. 2.68 million video views, and that's over 3 seconds in length, and over 155,000 visits to the website. So we were averaging around 5,000 to 6,000 people to the website, and it ended up at 20,000 a month. So for a less common cancer, that is a huge increase and way beyond what we were expecting. So just keep this figure here in mind when we go to the INCA statistics on the next page. So for the INCA social media, for this campaign, it's 20 net patient stories. We might have copied your idea there for having the 20 patients for posts and videos. So for the organic communication across 4 channels, so not paid media, for 6 months, January to June, 79,806 views. And then when you're able to put some funding towards it, which I know is tricky for everyone to get, but when you can put funding towards that across 40 days, that impressions went up to just under 25 million views across 40 days, which is astronomical, huge. So ours was 13 million across the 12 months. With our paid ads and with the global reach there, INCA has managed to get nearly 25 million views, which is astounding. So very good value for money as well. Now, Google Ads provide the Google Grants program. I'm not sure how many people have applied for this, but if you haven't done it yet, please do. I believe it's available in most countries. So for Australia, for not-for-profits, Google provide us with a grant of $10,000 per month. But the tricky thing is knowing how to use the grant. So we've had this grant for quite a few years, and on average, we could only spend $431, and that's purely because we didn't know how to spend it or what to do. And we're pleased to say that with the SEO partner, they've taken this grant under their wing, and we've been spending up to $8,895 per month. And in fact, last month we hit just under $10,000, like the full grant for the first time. So that's an improvement of nearly 2,000%. And it's more than just which words you're running, it's what other words your competitors are running and who's doing what. So it's having a really good understanding of the digital landscape. So before we had the partner working with us, we just put a whole pile of words in for neuroendocrine cancer, paraganglioma, neuroendocrine cancer, neuroendocrine tumour, any word we could think of. And even though that sort of did a little bit, it didn't do a lot. So you're able to run campaigns that encourage online donations and promoting awareness and or educational resources. And that's exactly what we've been doing. If you can promote, we can promote our videos, we can promote any of our fact sheets. Those things are a little bit more tangible, and the Google grant is worth its weight in gold. So we're very, very lucky. So even though the Google grant's free, we obviously need to pay a partner to get that grant up and running. But even if you're spending $1,000 to get that and sort of getting $10,000 back in marketing, it's really good value for money. And that's it for me. I'll keep talking.
So this was our public relations campaign, just giving a results snapshot. So they actually did 149 stories across TV, print, online and social media in total. So their KPI was to do 20 pieces, 30 at a stretch, and so that KPI was definitely reached. The sentiment, there was 100% of coverage was very positive, and it included at least 2 key messages each time, so that also was achieved. Spokespeople coverage included a quote from a NECA spokesperson for each of the stories, and you can see the breakdown by state with the reach. So we've pretty well covered all over Australia, which we were really pleased. The reach was 105,263 total via media, and the media placements nationally there were 72 and locally 77. So we really sort of were able to get out there, and I know our patients were super keen to be part of this, and they reached out to a lot of their local media as well, which, as we said before, really helped with getting the stories across the line.
And because their stories were so engaging, it really helped with the public relations company, not just dropping the ball when they hit the 20 pieces. They just kept going every month like they hadn't reached their KPIs, and that was really good to see.
And can I ask, just talking about those KPIs, sorry, just to jump in there. I mean, presumably they were around, that KPI was around reach and awareness gained. Was that
Yes.
your KPI? Yeah.
Yes, and so 80% of the stories, the agreement was 80% of the stories had to mention all the NET symptoms, and that's because our KPIs from the government were quite strict. So we had to obviously pass those on, but it blew them out of the water. We were very rapt with the coverage we received.
Yeah, and I think having those KPIs in place is another really important point, I think.
Absolutely, yeah.
Yes,
because
what it is that you're trying to achieve at the end is so important before you start, isn't it?
It is, and I think it also keeps the PR in line. That sort of, if you're slacking off, that we're noticing that we're not actually achieving the KPIs. So I think that, and because we were meeting every week as well, it was really keeping a close eye on what they were doing and getting their plan so that we could make sure that it had the impact that we wanted. And again, this is just...
Sorry, I was going to say the earlier comment we made around pushing a square peg in a round hole, when the article ran that we put a lot of effort in that was about medical scanning, we said that doesn't hit the government KPI, so that sort of, it didn't count, because there's no point in having neuroendocrine cancer in a story without mentioning the symptoms and wheezing, fatigue and abdominal pain. So it was good we had such clear KPIs that when a story hit and it didn't sort of hit properly, we could address that at the time.
Yeah, I can see that massively.
Sorry.
No, you're right. So this is just the final slide with the results breakdown, and this is just again for the public relations company. So for TV, we had a total of 30 clips, and that reached 2,406,000. Radio, we had 21 total clips, and so the reach there was nearly 280,000. Print, we had 14 total clips, and the reach there was 2.6 million. Roughly, and online we had 82 total clips, which was 77,557,000. So it really sort of was able to, it actually sort of grew itself in a lot of ways. And that, I mean, the media group, once they got to know us and got to know the patients, that they knew how to do things and what angles to do and to search out the right journalists as well, because we did have a few journalists that were challenging, that the patients possibly weren't that keen to talk to because of the way they handled it. So,
And we originally were trying to get, what we were trying to get, we really wanted TV, because it's just, you see it and you can get a full story, and the TV we did get was amazing. It was really in depth, but we can see from the total coverage numbers, TV now is not the be-all and end-all. Media's landscape is changing very rapidly. So even though we pushed really hard for these TV stories, at the end of the day, most of the coverage came from online, which is how people are consuming media these days. So it's important not to get hooked up on one particular, we only want TV or only want print, when really most people are looking online for news articles. And remember, our PR lady said one day she was catching the train into work, and the person sitting next to her was scrolling through their phone and reading a net story that she had organised the week before. She was very, very pleased she could sit there watching them read it. So that was really good motivation for her as well, to know that the stories are actually getting read.
Yeah, for sure.
And that's it from us. Thank you so much for your time.
Yeah, what an amazing campaign. I mean, just a huge congratulations to you all at NCOs, which is what I call you. No, I mean, it's truly impressive, and I know it's something that I'm sure we would all like to be able to achieve within our own countries. I mean, if I can just start off, obviously I'll go out to questions in a second, but just to try and talk a little bit about some of the challenges that I'm sure you faced, although everything that you've presented is hugely brilliant. Just a couple of questions, really. First of all, you said you had to choose and work with a media company to achieve this. You couldn't have done it in-house, which is a very clear message that you've given. Finding that media company, you alluded a little bit to, you met a couple that you realised it's probably not going to work. What was that process? Did you send out proposals to various PR companies, and then have a sort of interview process? How did that work?
Oh,
think-
am I?
I was just going to say, with our contacts sort of across 480 and Meg's, and well, I know some PR people as well, we actually sort of reached out to them and asked them to put proposals together. And we knew how much we could spend. There was one company that is absolutely amazing, but it would have spent everything that we were given for the whole campaign just for them, just for the PR. And we just sort of said, can you cut this back a bit and sort of like so that we can actually work with it? And they cut it back a bit, but it was still totally sort of, unrealistic and not achievable. But I think, Adi, if you want to continue.
Yeah, and initially we were thinking we probably needed a PR that specialises in health. They are really expensive, those companies, and we probably learned our lesson in a valuable way because the PR company that we engaged with put a health consultant on that specialised in health, and she was a very intelligent lady. She was fantastic, but we did not get any coverage when we were with her the entire time. So for the first 4 months was a little bit hairy because she wanted the bigger story. She spent so much time doing research and understanding the disease and what the blockages might be and who else is doing what at the time, and she maybe overthought it too much. And she ended up leaving the company, and we got a junior girl in who was incredible and just wasn't so sure of herself and just started with the smaller patient stories, and that absolutely blew up. So it was a blessing in disguise. So we're very grateful that we didn't go with a health PR company in the end because it probably wouldn't have had much coverage, and just choosing someone that you really click with. And both of the people we're dealing with at the PR company were hugely empathetic, and really towards the end, we really want to continue doing it. They really understood the disease. They spoke to so many patients. They didn't want to let anyone down. They were highly accountable. So sometimes I think it's not about the big, beautiful brand. It's just about the human connection and knowing if they connect with us and they connect with the patients, and of course they're going to connect with the journalist.
And I guess just, a really basic question, but what words did you use to describe neuroendocrine cancer, neuroendocrine neoplasm, NETs, NECs? How was that taken up? Because, I mean, we find that to be quite a difficult challenge. Just the word itself is a little bit complicated and unsexy and a bit difficult to explain. I mean, what did you do to become that?
We had our little 2-pager, which is very short information about NETs and NECA, and we didn't really need to overcome that, Catherine. You think we would, but again, when we had the health professional working with us to start off with, she was very much overcomplicating it, wanting to know neoplasms, like literally every single word. But what the journalists really want to hear is this person has a cancer that you've never heard of, neuroendocrine cancer, and these are the challenges they face. And this is passed it down to the children or whatever their key things are. They took 7 years to get diagnosed. They're at stage 4. They can't afford the medicine to get better. That's all they need. So we think sometimes we're trying to over-explain too much. They don't really need to have all that information. It was really just sticking to the patient stories and the patient information.
Yeah, and I think emphasising the complexity and the vagueness, and sort of, that it could be anything really, and that's having the patient story, and for them to go in and say, this is not like any other cancer. And these patients, are really suffering, but nobody's hearing them, and being able to sort of get that story across the line.
Yeah, thank you. So is there any questions out there? Lisa.
Hey, sorry, I had to download a new Zoom and I can't find my hand up, the physical one. But just what a phenomenal campaign, like so inspirational and motivational, seeing what you've achieved. It's quite incredible. I guess my question is more, specifically to the healthcare professionals and around whether there were any messages or hooks that really seem to have traction with them, or get them interested in an area that, as we all know, they're perhaps not that interested in.
I think, well, with the education modules that we have, that they're accredited, so they actually do get points for it. The first accreditation that we had, they actually got 40 points, which was a year's worth. But since then, they've reevaluated and it's down to 10 points. So, not quite so good. But I think the fact that so many of our patients, I mean, seeing a GP, especially who doesn't know anything about it, and the frustration that our patients have. And we did have one story that was, we had one of our clinicians who was talking about neuroendocrine cancer at one of the big television stations later at night. But he was going through it, and like he was saying that he goes along to a party or something, and they say, "Oh, what do you do?" "Oh, I'm a doctor of neuroendocrine cancer." "Oh, brain, is it?" He's going, "No, it's not brain." And so then having to explain that. But then he went through everything in this session or the program that he was on, and we had a patient who was living in South Australia, and she was profoundly deaf, and she was going to her GP constantly with all the symptoms of neuroendocrine cancer. But it was during the GP was wearing a mask, and so she couldn't lip read. And so she was getting more and more frustrated with him. He was not even thinking, and he was about to refer her for psychological assessment because he sort of said, that you're having all these anxiety issues, there's nothing else wrong with you. Luckily, her mother saw the television program. They brought the recording into the GP, and she since has been diagnosed with a neuroendocrine cancer. But it was, astounding. And I think it's just the fact that we've had some of our clinicians that are doing this information that are respected, and then other clinicians are knowing these people and hey, this could be something that, we need to think about. So, yeah.
And Lisa, another way we got them engaged was Dorothy Keefe, who's the head of Cancer Australia. Cheekily, we asked her if she could do a video, and that got the most traction. So nearly 500,000 GPs stopped scrolling and looked at her video. So having someone that they know and trust. I don't know whether she's done any other cancer videos. I don't believe she has.
She hasn't, but no.
Yeah. So she rarely does any media. So to have her front, and that was nothing to do with the sort of camouflage campaign. It was completely separate, but we just thought that would be worth the investment for her because she's so well known in Australia. That really made them stop and think.
So ultimately, just in a way, it wasn't even what you were saying, it was who that was saying it, and that's
exactly,
peer or respected person outreach that really kind of cut through.
Yeah. Okay. And one of our other clinicians who is one of the lead, David Chan, he did an article that was in Endocrine magazine about uncomplicating NETs and everything, and it was co-written with a couple of other doctors. And we were fortunate enough to have our advertisement for our camouflage campaign on the page that his story was. So that drew attention there. But then there's been so many people that healthcare professionals that have read the article, and it's just been phenomenal. Yeah.
That's amazing. Thank you.
And one other way is we patients can download the education module flyers from our website. So they take them into their GP and just say, "Have you done this course?" And that's a really good way to cut through, because be a brave GP to say to a patient, which has happened, "No, and I'm not doing it." So that helps as well.
They've found another GP very quickly when they realise they're not interested.
I don't blame them. Emmanuel, you have your hand up.
Emmanuel.
Yes.
Did you want to ask a question?
Yes. Can you hear me?
Yes.
Okay. Well, first of all, congratulations. I guess Australia is now the best educated country in the world on net. So we'll just direct all our websites towards yours, and then we're done.
Still got a long way to go.
Two questions. I don't know if you can answer the first one. The first one is, what was the budget you had for this campaign? And the second question, if I can kind of pick on your brains on something. I mean, this is obviously a public outreach campaign, so I guess your target was everybody. If your target is just targeting the patients, so you would have a limited budget and generally limited resources based on the work that you've done. What would be your thoughts? How would you try to tackle that? So if you wouldn't target doctors or hospitals, etc., are mainly patients, potential patients. How would you go about doing that? So the first one is about the budget, if you can share that, and the second one, how would you tackle the just focusing on patients?
So the budget was 550,000 Australian dollars for a national campaign. That's not a lot of money here. So for a national media campaign in Australia, if you wanted to get TV and things like that, you'd be looking at sort of 5 to 10 million. So even though it's more money than we've ever spent, it certainly wasn't a huge amount of money. And we did discuss...
Can I just interject there that part of that was actually for resources as well, and education. So it wasn't just for the awareness campaign. It had to have other parts of it as far as resources and education.
Yeah. So that money was also for creating videos and doing the net patient forums and attending conferences. Actually, I reckon it was about 250, I reckon, for the actual media when I'm thinking about it. Now, how to target patients. We did discuss that, Emmanuel, earlier, whether we targeted people that had been looking for menopausal symptoms or abdominal pain. And because we were doing a general public campaign, we decided not to do that. So the cost per reach, once you start overlaying things with all the patient symptoms, you'd be reaching a lot less people and you wouldn't get as big bang for your buck. But because we thought it's equally important to just reach everyone with this campaign, we didn't close it down. But if you specifically wanted to reach people with these symptoms, there are absolutely ways to do that. So your SEO or your digital person would talk about the symptoms that are important to you in your country, and then you can target people that may be looking at those symptoms online. But particularly we know, I'm not sure whether it's like this globally, but we know 50% of male and female people have nets, but most of the people, around 80% of the people on our Facebook page are female. So it's really important that we reached everyone, because even if we didn't speak to a patient, and we saw that in Danae's case, whose mum saw the TV campaign, if a friend or a carer can get those messages as well, they will also talk to a patient. So we wanted to reach as many people as possible.
Yeah, general awareness is the key, really. Yeah.
Thank you, guys.
Okay, thank you. I wasn't questioning the strategy. I was just trying to pick on your brains if you wanted to target.
Yeah, you could do that. Yeah, it would be,
definitely,
it would be an expensive campaign.
And definitely, I mean, the number you gave is probably much lower than I would be expecting, honestly, on the budget. So obviously the effectiveness was quite high. So yeah, definitely.
I think we used our money very well.
You did. Thanks both. And we're coming to the end now of the webinar, but I wanted to just ask just one further question around, we know that media is a really strong tool for us, and many of us don't use it to the best of our abilities, or we don't have, as you say, in-house expertise, etc. But what's the right thing to do when the messages that you see out in your media are wrong?
We contact them straight away. So
what sort of response do you get back from that?
Em, do you want to talk to that?
Yeah. I mean, we had a couple of stories that were done that we didn't know about that actually sort of weren't right. And we contacted them, and they actually gave us the opportunity to rectify it without sort of, putting it back on anybody that they'd said the wrong thing. So it's being very diplomatic, but then just wording it so that we are getting the right story across.
And do you have a journalist pack? Do you have something like that on your website, information for journalists if they happen to come across your website? And is that something, I know you used something like that in the campaign when you had sort of a flyer with information about the disease and how many incidents, diagnosis, that kind of stuff. But do you have anything that's available outside of the campaign?
We don't have anything, and it'd be a long shot for a journalist to get on and not have contact with us, because generally, as we said, it's about those smaller patient stories. So 80% of the story might be on the patient, and then it might be sort of 10-15% talking to NECA, and then 5% talking to the healthcare professional. But or we would love for someone just to do a story on NETs, but I can't see that happening in the near future.
Yeah, I think it's been really fortunate sort of with the von Hippel-Lindau side, where we're looking to try and get this drug belzutifan on the PBS here in Australia, that we've actually got 2 patients who are very strong in the media. So they've actually reached out to their colleagues and friends and been able to do things that way. And one of the patients, she is a journalist herself, but then she's got contacts, so they ended up doing stories via her friend who works for news.com, which is one of the major media outlets in Australia. So it's utilising, the patients, the contacts, the community that we've got. And we met those people because of one of the MPs who introduced us, did an e-introduction, so that we could then be there to support them. And we've sort of built on those relationships since.
Yeah, that's wonderful. Well, I mean, congratulations. I guess the feedback from everything that you've said is that we need to keep it simple. We need to be consistent. We need to utilize our community because they're our biggest source of power, I guess. We need to find some champions. We need to be persistent, and we need to find some money and expertise.
Yes, and our consumer advisory group, which I just realized we left off a very important part. Our consumer advisory group, we stayed in close contact with them throughout the campaign, so to make sure they were happy with the creative. Is this, you know, easy to understand? Is it layman's terms? So the whole way through, making sure that we weren't overcomplicating it and just keeping it really simple.
Brilliant. Well, you know, just congratulations. It's amazing, and I think, as Lisa said, it's inspiring. So thank you for sharing your amazing work and for being with us here this morning. Thanks so much.